So the study was evaluating a drug called ripretinib in patients with gastrointestinal stromal tumor who have progressed on the standard therapies of at least imatinib, sunitinib, and regorafenib. The study, we know that those patients don't have any approved options. There are some things that have been assessed and patients may have tried, or other clinical trials, but it was really for those patients in whom there is no standard of care. So the study was designed as a placebo-controlled study. The initial study phase was a blinded phase, and patients were randomized 2-to-1 to the ripretinib versus placebo. So we found that patients who started on ripretinib had a significant improvement in progression-free survival compared to placebo. And there was a reduction in terms of progression as well as death by 85%. So I think the implications are that this is an active drug. I think one of the things that we found that was surprising, that even after patients progressed and were unblinded, they were allowed to cross over. But even with that design, patients had an improvement in their overall survival, being on ripretinib as their first line. Those patients that were able to crossover did have a benefit from placebo to ripretinib. The difference in overall survival for those patients was about 2 months for those patients who never crossed over, to about a year for the patients who crossed over. So I think all of this information suggests that ripretinib is a very active agent for patients in this line of therapy who have no active options. And hopefully, as we move forward, it will become available for patients in that space. Most of the adverse events were grade 1 or 2, and sort of what we would expect from tyrosine kinase inhibitors. One of the things that was unusual was sort of alopecia or hair loss, seen in about half of the patients. The hair loss happens, but then hair does seem to grow back. In my experience in treating patients on this trial, when it grows back, it's somewhat coarser and oftentimes curlier than the natural hair. But that's a difference. The other things that were seen were hand-foot syndrome, or PPE, which we do see with some of the other approved agents. Compared to the other approved agents, the consensus experience is that it is less intense than what is seen with some of the other drugs. There is less sort of actual peeling of the skin. It's more sort of dryness. It's real, but very manageable, and primarily grade 1 or 2 and not severe grade 3 toxicity. From the perspective of thinking about patients who have progressed on standard therapy, hopefully this will become an approved agent. Overall, the toxicity profile was very, very manageable and similar to other agents, with exception of the alopecia. And I think it's hopefully will become a new standard of care for patients in that space.